Hey everybody, welcome back to Ask Dr. Dan. I hope you all had a great weekend. This week we're going to be talking about extracorporeal pulse activation therapy, or EPAT for short. Some people also know this as shockwave therapy. The way this works is it's a completely non-invasive treatment that uses sound waves to actually penetrate into areas of injury. And what that does is it helps stimulate blood flow, and it also helps to create a little micro damage to the area, which then heals and helps to reshape the tissue. For this treatment, there are normally three parts. So the first part, what we would do is we'd find the hand piece that would be proper for the treatment we are performing. So we would just put that on here. Okay. Then what we would do is we would set this very low at first. Our goal is to actually create a little bit of discomfort. We want about a 6 out of 10, because that tells us that we're in the right spot. And then basically what we do is it creates this percussive force, almost like a little jackhammer. So we do this part, and then when that's done, we actually switch the heads, and then we put on a second head. And what this is for is actually to treat this soft tissue around the area. So for something like a chronic tendon, like a tennis elbow or a plantar fascia, you also want to treat the muscle around it to help loosen it up so that it's not tight anymore. And then you would do the same thing. You would just move this around, okay, in that soft tissue area until it was until the full treatment was performed. And then the last thing that you do is you use this to the area, and this is almost like a really nice massage. It just, again, stimulates that blood flow and gets everything going. So this can be used for really any soft tissue area. It could be used in the extremities. It could be used for trigger points in the back. And again, it's very non-invasive. It's usually about anywhere from 3 to 6 treatments once a week. It may take several weeks to kick in, but there's no restrictions. You can kind of go back to life right after the treatment. So we'll be taking your questions over the course of the week. I hope you all have a great week. And remember, don't operate, regenerate.